Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Aultman Health Systems, Studio Arts and Glass, and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our guests are Melissa Overly, pharmacist, manager of the manager of the Medicine Center Pharmacy in Minerva, Ohio, and Michelle McCann, physical therapist with Aultman Therapy Services. It's a family show today as Michelle and Melissa are sisters, working together to share important information about fall risks today. Good morning, Melissa and Michelle. Welcome to the show.
Hi, Paul. Good morning. Good morning. Thank you.
Fall prevention may not seem like a lively topic, but it's important. Each year, millions of adults age 65 and older fall. Falls can cause moderate to severe injuries, but the most important message is that falls can be prevented. Falls are often considered to be part of a syndrome. In other words, more than one thing may be causing the condition. As a result, there is often a benefit from a team approach where various disciplines can contribute to the assessment and treatment of the condition. Today, our discussion includes both a physical therapist and a pharmacist to get their perspectives on fall prevention. We'd like to remind our listeners today, our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Melissa, welcome to the show. Tell us a little bit about yourself and your background.
Hi, I'm Melissa Overly. I'm the pharmacy manager at the Medicine Center Pharmacy Minerva. I have worked there for a little bit over 12 years now. I graduated from the Ohio State University College of Pharmacy in 1999, which definitely ages me, but I have worked retail pharmacy my entire career. I enjoy working with people and being able to talk to my patients on a daily basis and have an impact in their daily lives. So I don't want to be anywhere else. I do really enjoy being there at the Medicine Center, and I do enjoy retail pharmacy.
And Michelle, welcome back to the show because you've been on before, as I recall. Tell us a little bit about yourself, your background, and your responsibilities at Aultman.
Well, thank you, Paul and Brad. It's great to be back again. And Melissa, thank you for educating alongside me today. Because this is a family affair, I'll just say quickly, hi, Mom, and hi, Dad. Thank you for tuning in.
Okay.
That's Bob and Sue Miller, so we have to say hello. I'm a physical therapist in the outpatient setting at Aultman Tusk. Aultman Tusk is located across from the main hospital, and we're neighbors with your Canton Medicine Center store. My areas of specialty within physical therapy are in the treatment of chronic pain, lower back pain, and in orthopedics.
So, Michelle, when we discuss fall prevention therapy, who should we be considering?
Well, I say everyone. We all live in a world with gravity, and falls are truly accidents. For Health Matters today, we'll focus on higher risk groups. The bottom line is many falls can be prevented. So who is fall prevention therapy for? The higher risk group includes many of our listeners. You're at risk if you're 65 and older. You're at risk if you're on more than 4 medications, and Melissa will talk more about that soon. You're at a great risk if you've had a history of falls. So the statistic is falling once doubles your chance of falling again. A few more, you're at risk if you use a walker or a cane, if you have a balance disorder, if you have muscle weakness or arthritis. You're also at risk if you have any vision problems, any neurological deficits, for example, a stroke or a spinal cord injury, if you have depression, cognitive impairment, or if you've had even a cardiovascular deficit. So who is at risk? I imagine our listeners today can identify with one or more of those categories listed.
So how costly and serious and how costly can a fall be?
Well, it's very surprising when I read this information, but I found out that actually 1 out of 5 falls causes a serious injury, such as a broken bone or a head injury. And 1 out of 5 is just a scary number. And falls are the most common cause of traumatic brain injuries and hip fractures. In 2015 alone, the total medical cost for falls exceeded
$50 billion. And of that $50 billion, 75% of that cost had to be shouldered by Medicare and Medicaid alone. But besides the cost, what really, I think the biggest cost truly is the cost to how it affects people's lives. From what I see with my patients on a daily basis, the falls are the most common reason why people lose their independence. And unfortunately, sometimes to never regain that independence again. So if that fall could be prevented, it could really improve a person's long-term quality of life. That's the biggest cost I see.
So what does fall prevention involve, and what are the goals for a multidisciplinary approach to treating falls?
Fall prevention, as far as a multidisciplinary approach, actually involves four main groups of people, as we can see it, working together, all from different angles of expertise. Those four groups of people would include the physical therapist, the pharmacist, the doctor, family doctor, the eye doctor, and I guess the fifth would be the individual themselves.
And from this collaboration team, these treatments can include just working on building your strength and endurance with an exercise program, which starts in physical therapy, but continues after the completion of physical therapy. Balance and enduring training, again, that is learned in therapy, but that you have a lifetime plan to maintain. Implementing lifestyle changes that address ongoing risk factors. We're going to be talking more about the medication review, regular vision testing, your physical activity. And lastly, just working on making sure we provide our patients or our listeners with information on creating a safe environment.
What does a physical therapy evaluation for falls look like?
Well, if the patient is referred to therapy for an evaluation, either following a fall specifically for fall prevention, they would see a physical therapist for initial evaluation. That visit takes about an hour long, and it's highly individualized. So if you came to see me for physical therapy, I first want to hear your story. I want to hear how you felt, what happened, what led up to it, what got injured, how are you doing, and what happened, later that day, whether you went to the emergency room or what medical care you received initially. I want to know about your pain and your overall healing. Then I would go through the assessment part of checking your strength and looking at your walking, watching your walk to make notes of any imbalances that we can work on with therapy. I would also have you undergo some balance testing. Balance testing is special testing that is intended to produce a score that I can do your first day and maybe several weeks later at the end of your therapy to look for your amount of improvement in your balance, and also to provide information back to a physician of your baseline scores. I would also check your vitals. A lot can be learned, for example, with just checking your blood pressure in sitting, standing, or lying. Some good basic advice is to stand up slowly to avoid dizziness, and that you should pause in initial standing before you take off and walk too quickly. A few more things we check at your physical therapy evaluation would be your endurance and your aerobic cardiac tolerance. We'd also have conversations about your nutrition and wellness. Just are you staying hydrated? Are you making choices about your own health and wellness? If you're having specifically dizziness, we'd have you see one of our vestibular therapy specialists. This is a specialty of PT that's aimed at getting to the root cause of dizziness, and we offer that here at our Aultman location. And finally, we come up with a plan together, working with the patient to determine what exercises are most appropriate and what your long-term plan is after physical therapy.
Okay, Melissa, can you explain to our listeners what a comprehensive medication review is by a pharmacist?
Sure, absolutely. A comprehensive medication review, also known as a CMR, is a chance where a patient gets scheduled one-on-one sit-down time with a pharmacist to review their medications. This is also called a brown bag review. because we like to ask the patient to bring in all their medication bottles in a bag, everything they take, whether it's prescription or over the counter, whether it's from the medicine center pharmacy or their mail order or another pharmacy, just so we can get a look at everything that they take and just try to make sure that there's no duplications between things that are filled at different pharmacies or interactions. Lots of times, unfortunately, even with the prescribers, they don't always have a good list of everything a patient takes because they go to multiple doctors for multiple different specialties. And so it's a good chance to just look at the big picture and find out if the big picture makes sense. Also look at patients' technique with certain medications like inhalers. Are they using them properly to get the best effect out of them? Do they do they understand as far as if they're on insulin, how to properly use the insulin pens and how to interpret what their blood sugar means. And it's just a time I really enjoy a lot, because normally in a day-to-day time, we're so busy, we don't get to talk to our patients that much and get to see the big picture. And it's enjoyable to get to see the big picture and get to know our patients better. It's especially helpful for patients who see multiple doctors or go to multiple pharmacies or take multiple medications.
Our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, don't forget to stop in for your flu shot or a COVID booster. Walk-ins are welcome or appointments can be made on our website, medshoprx.com. We look forward to helping you stay healthy.
Okay, how can a comprehensive medication review by a pharmacist help prevent falls?
Yes, absolutely. This can be beneficial at looking at the fall risk and preventing falls. Pharmacists, when sitting down with patients, can look for medications that the patient may be taking that can increase their risk of falls, or in combination with other medications when put together that can increase the risk of falls. The pharmacist can look for medication that's what's known as the Beers list, which is a high risk list of medication for older adults. And then after looking at the list to determine which medications may be high risk for the patient and may potentially contribute to them having a higher chance of having a fall, it can be determined if possibly if any of those medications can be reduced to a lower dosage, possibly changed to another medication that may be just as effective but of lower risk, or possibly if the medication can over time even be eliminated if it's not absolutely necessary.
I know we have a fancy term for this. Can you explain what de-prescribing is?
De-prescribing, yes. And it's a kind of an opposite term of what people normally think of when they go to the doctor. They think that, oh, I'm going to the doctor, it's going to put me on more medication. Well, sometimes more isn't always better. Sometimes we find that the patients end up, as they get older, maybe being on medications that when they were younger, they were safe, but as they age and their body's metabolism changes and their abilities change, that possibly those medications that were safe when they were younger tend to not be as safe as they age. And the pharmacist can work together with the patient's physician to look at the medications which possibly may be at high risk for the patient or unnecessary for them to be taking anymore as they age. When the pharmacist and the patient and the doctor work together to look at this, it's possible that some medication doses may be able to be reduced, or medications could be changed to a safer option, or even a non-drug therapy may be tried, or a lifestyle change. And I do have one word of caution with this, though. I don't want anybody to try to stop taking any of their medications or reduce them without their physician's advice and their physician's help. It's up to the physician working with the patient and the pharmacist together to determine what medications may be able to be reduced. Some medications are not safe to be stopped suddenly, and some medications are not safe to be stopped at all. That being said, though, that there often are safer alternatives for patients, but always done under the doctor's advice.
Interesting.
Can you touch on a couple of the main categories of medications that can directly impact falls and maybe a couple of examples that might resonate with listeners today?
Sure, absolutely. And like I mentioned before, if you take one of these medications, just, don't jump to any conclusions and just stop the medication suddenly, because that's not what we're trying to hint at all here. But the main three categories, the way I like to think of it at least, are number one, medications that affect the brain. Category number two, medications that affect the blood pressure. And category number three, medications that affect the blood sugar. The first category, medications that affect the brain, is really an extremely broad category, but it can include medications for anxiety. Lots of times things like lorazepam or Ativan. It can also include medications that are used to help people sleep, possibly like zolpidem or other medications for insomnia. It can include certain medications for mental health, or certain what are known as antipsychotic medications. Can also include certain pain medications. Opioids would be in this category. So would certain antidepressants, and even some allergy medications, potentially like Benadryl, could be considered in this category that can affect the brain. So it's a very broad category of a lot of very useful, but also some very high-risk medications as well. Medications that affect the blood pressure. Michelle had mentioned this earlier, as far as the term is called orthostatic hypertension, where your blood pressure can drop suddenly when you go from laying down to sitting up or standing. And there are medications that contribute to that problem. Some blood pressure medications do. An example would be clonidine. And then also some examples would be some medications actually that you might not even think of that have that effect as well, that are for urination, like tamsulosin, which is also known as Flomax, or doxazocin. And so when these medications or medications similar to these can cause a sudden drop in the blood pressure, if that happens when someone's standing, that could cause them to get dizzy and have a greater chance of falling, especially if they get up quickly, especially during the night. And then the last category that I mentioned, and this deals mostly with patients that are diabetic or on medications for diabetes, but medications that lower the blood sugar. Because if the blood sugar drops suddenly or stays low for too long, that can contribute to a patient's risk of falling. Two examples of ones that we think of a lot are glimepiride and glyburide, because they can cause, in some older adults, prolonged blood sugar that is too low. So an example like this, a better choice would be something like glipizide. So that is one of the things that can be done, is just switching from one diabetic medication to another to try to reduce the risk of the blood sugar going too low for too long. Insulin, of course, can be a problem as well. Insulin is definitely a life-saving medication, but if it's used in a patient that's not really understanding how to take their insulin, or not, checking their blood sugar properly or staying on top of it, unfortunately, insulin can cause the blood sugar to go too low. There are some new meters out, like the Dexcom, which are really good as far as even continuously monitoring the blood sugar and sending alerts to the patients they know their blood sugar is too low. So something like that, if you're diabetic and you have risk of your blood sugar going too low, something like that is a very good idea.
All right. Well, you just mentioned quite a few medications that we see patients taking frequently. If someone's concerned about one of the medications you just mentioned and are concerned about a fall risk, what message do you have for them to talk with their doctor about?
Okay. Yes, absolutely. As I said before, do talk to your doctor, and don't just try to take yourself off one of these medications on your own, because it could absolutely not be safe. But what the CDC is telling healthcare providers is pretty simple. It's just a 3-word acronym. It goes stop, switch, reduce. So stop is for stop the medication when possible. Switch is switch to a safer alternative. Or reduce the dose to the lowest effective dose possible. So it's not, it's not, with all medications, it's not possible to stop them, but it is possible to at least go to the lowest effective dose, or maybe potentially switch to something that is similar but much safer as far as not being nearly as risky for an older adult with their risk of falling and everything. But it's very important that the patient is on board with this and actively participates in the decisions that are being made if it's involving changing any of their medications. The thing that we see that's really hard is some patients we see most often say, well, I've been taking that, particular anti-anxiety or sleep pill for 30 years and I've never had a problem.
Yeah.
And true, you haven't had a problem yet. But sadly, as we age, some of these medications that were so, helpful when we were younger, but as we age and, our body is changing, sometimes they become a problem, even though they weren't a problem before. But it's so in that respect, sometimes it's hard to see that, but it really is true.
So for every potentially risky medication, what are some questions that maybe a patient should ask their family doctor or pharmacist?
Well, this may sound simple, but the first question is, what is this medication for and why am I taking it? When we review medications with patients, lots of times they say, well, gosh, I've been on that medicine for 10 years and I'm not really even sure why I take it anymore. So why am I on it? And okay, if I'm on it, is it still necessary for me to take it? Or possibly, is there another option that would be safer for me to take? And then of course, what are the risks and benefits of either continuing the medication or stopping the medication? With medication, it's not as nearly as black and white as we would like to think it is. Everything pretty much has to be weighed on a risk versus benefit ratio. And there's of course always a risk to stopping a medication and there's a risk to continuing a medication. You kind of have to look at which is bigger for a particular patient in their situation. And of course, the question of, okay, if I can't stop this medication, maybe can I take a lower dose for a while and see how I do with a lower dosage?
What should our listeners do to consider if they want to make their home safer? Now, I know we got rugs everywhere in our houses and things to trip over and dogs and cats to trip over. What do we do?
Well, many falls happen at home where we spend much of our time and tend to move around without thinking about safety. But you were absolutely right. The first thing you said is rugs. Remove those loose throw rugs and reduce clutter. If we've lived in our home a long time, we tend to accumulate lots of stuff. We can also look at our seating. It's best to have chairs that are not too low and that have arms and have no wheels. So our rolling kitchen chairs or computer chairs would best to be a standard chair. We need to look at lighting, especially in bedrooms and in stairways. One thing you can do to make yourself safer in your home is to wear proper shoes. The safest shoes have laces or Velcro and are more traditionally like a tennis shoe or athletic shoe. The highest risk of falls comes from walking around in bare feet or stocking feet. You can also ensure that you've got handrails on both sides of the stairs and that if you're not able to safely complete your stairs, that you can consider a stair lift. It's best to not stand on tables and chairs. There's a lot of tools that we can show you in therapy, like using a reacher stick to get something off of a higher area. And grab bars are fantastic. You can place a grab bar in a home anywhere you naturally touch the wall. For example, going from one step down to the next step where your hand automatically contacts.
It's time for a break. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Michelle McCann, physical therapist with Aultman Therapy Services, and Melissa Overly, pharmacist at the Medicine Center Pharmacy in Minerva. We have a lot more to cover this morning, so let's get back to the show. How can we be best prepared in the event of a fall?
That's a good question, Paul. Hopefully that fall never happens, but if it does, obviously we want to be prepared. And this is especially important for anyone who lives alone, especially if they're older and if they fall, they may not be able to get back up on their own. And one thing that is very helpful is something called a medical alert device. And a medical alert device is something that can be worn as like a bracelet or a necklace that can help alert the 911 or medical personnel if you've fallen, and make it so that you're not just, laying there where you can't reach help. If another option besides medical alert device would possibly even keeping a cell phone on you at bare minimum so that you could try to call somebody if you fell. But it's very, very important to have some way if you fall to contact somebody. I saw this actually very scaringly firsthand.